And now we're here with Dr. Kieleszewski. Thank you for coming to the show and joining us today.
Thank you for having me.
No problem. Just could you share with us a little bit about your background and your experiences?
Sure. I am born and raised in southeastern Michigan. I attended Michigan State University's College of Osteopathic Medicine for medical school, and I'm proud to say I truly am an osteopath. I attended McLaren Macomb for both internship and residency, and currently am in a private practice practicing family medicine in Clinton Township.
Okay, nice, perfect. Well, the question of the day, and I'd like to know myself for personal reasons because I don't get a lot of sleep, but are Americans getting enough sleep?
The answer for nearly half of Americans is no. And matter of fact, about 30% of us are legitimately sleep deprived, getting less than 6 hours per sleep on average each night. And that absolutely correlates to problems. That number translates to about 96 million Americans. So the vast majority of us need to get more sleep in our daily routine.
So what does that amount of sleep look like, that number of hours of sleep look like?
It certainly depends on your age and different circumstances, but what I share with my patients and parents, for example, when I'm talking about their children, is a general rule that for each age group, it's about a 2-hour difference in terms of sleep throughout the day. For infants, they require 14 to 16 hours. That does include their naps. Toddlers, more so 12 to 14 hours per day. For school-aged children, 10 to 12 is ideal. Once we get into the teenage years, despite what many parents and teenagers will tell you, they still need 9 or 10 hours per night.
Okay.
And lastly, for adults, which is certainly the majority of the issues I discuss, they still require 7 to 8 hours per night. And many adults are still surprised and will not admit that is in fact in their best interest and benefit.
So why do you think what are some of the issues that adults might be, when you see them come into your office, that they might be experiencing that because they're getting possibly lack of sleep?
Many issues exist.
Okay.
By far the most important aspect in terms of my interaction with my patients, we have to start with sleep hygiene. What things are going on leading up to their retiring for the evening? What are they doing to put themselves in a calm, relaxing state? What is the bedroom like? For example, it should be dark, it should be quiet, there should not be lights, should not be sounds like a television or a radio. Are there any objects, pets in the bed that are distracting us?
No pets in the bed.
No,
I'm guilty.
absolutely not. So many
Definitely
people do admit to having their friendly fur ball with them. That's not a good practice. Children also. Children should not be sleeping in bed with mom and dad.
There too. Okay. So are there any medical conditions that might hinder patients from being able to sleep and get that good night rest?
Absolutely. Plenty of people suffer from issues such as insomnia or just general anxiety that prevent them from falling asleep within a reasonable amount of time. Others wake up during the night for different reasons, whether that's they're restless, perhaps restless leg syndrome. Some people, unfortunately, have issues where they have to wake up frequently to urinate. And there's also plenty of other people that have other sleep-specific disorders, such as obstructive sleep apnea.
And how do you acknowledge the fact that these patients come into your office and want to do a sleep test?
Sometimes patients will be very forthcoming, and they've been told by a family member or their spouse that they snore and they stop breathing. That's a pretty easy segue and assessment into those issues. Other times it has to be a little bit more investigative and more questions coming from me to really pull the truth out of what it is that's affecting their quality of sleep or quantity of sleep.
So what would cause a patient to have lack of sleep? What are some of the outside influences that would affect the sleep of that person? I know we talked about work and stress and anxiety.
The actual quality of sleep that we get is sometimes just as, if not more important than the quantity itself. Going back to feeling stressed or anxious, some people, my wife included, often finds herself lying in bed and her brain starts to spin with what she has to do the next day, what errands are on the agenda, and she finds it helpful just to write that list of things to do before she even goes into the bedroom at night. So she feels a little bit more at ease. She wakes up and she starts attacking the day, per se.
That's really good advice. I'm going to have to take that as well. And are there any breathing exercises or anything that one could do for to be able to stop being so anxious or worrying before they go to sleep?
I absolutely encourage people to do various relaxation activities, whether that's simple breathing, praying, doing yoga, just basic stretches. You don't want to be overly exerting yourself or exercising, running miles and miles around the neighborhood or on the treadmill right before you go to bed, but it is helpful to be in a calm, relaxed state and just be ready for your head to hit the pillow and get a good night's rest.
So how can this lack of sleep negatively impact our overall health and well-being?
In many ways. As a matter of fact, a recent poll found that 45% of Americans admitted to having their sleep or lack thereof negatively impact at least one day in their life over the past week. And some of the ways that can affect us is to be a precipitating factor and lend to chronic diseases such as hypertension or high blood pressure, diabetes, depression, low testosterone, particularly in males, and not to mention what we all can attest to is our general crankiness from time to time and irritability. And in one other aspect where we see sleep deprivation negatively affect us, motor vehicle accidents, mishaps in an industrial environment, or just general lack of productivity in the workplace.
Okay, so no television, no looking probably at a telephone or an iPad. Make sure that the room is quiet and no fur babies or dogs in the bed, cats with you as well.
Absolutely.
And for the average adult, how many hours of sleep did you say?
7 to 8 hours
7
per
to 8.
night is
Okay.
what's recommended, and that obviously can be increased based on acute illness or injury, because we should certainly be giving our body slightly more sleep in those periods to allow ourselves to heal.
Okay. So what can we do moving forward once we as patients have said, okay, I need to go and see my doctor because I'm having lack of sleep. I'm tired all the time. I'm irritable. I can't function at work like I should. We make an appointment to come and see you. At that point, what test might you do so that we can say, okay, this is the reason and here's the reason why I'm not sleeping good at night?
Step one is always addressing the sleep hygiene issues.
Okay.
How are we preparing to go to sleep? The setting of the bedroom, like we discussed. And until we have taken those issues seriously and the patient will attempt to make the changes, I would never even consider putting anybody on any kind of prescription medication. That also does lead sometimes to prescriptions. Also, like we mentioned with sleep apnea, that does require a specific sleep test. It's called a polysomnogram that is performed in a specific sleep lab supervised by trained technicians. It's discussed and reviewed by a trained sleep medicine physician, and the results of that are not always just clear-cut with sleep apnea. There's many other diagnoses that can potentially be discovered during a actual sleep study.
Like what other type of diagnosis?
Restless leg syndrome, various forms of narcolepsy. Different people also sometimes struggle to actually go through all the different stages of sleep. To be technical, there are 5 stages of sleep, and we cycle through those stages every single night, 1 through 5, over and over and over. Some people struggle to actually get into those later stages, which are the deeper sleep, where we become harder to arouse, but where we also are getting more significant rest, where we're improving our immune system, where we are solidifying what we've learned over the day and the previous weeks. And that's one of the big misconceptions that people have is sleep is not just for rest. Sleep is for our minds as well, just as much. We solidify what we've learned, skills, information, and we hone it into more of a long-term memory.
So those 5 stages are very important to go through. Do you find that
Yes.
most of your patients are going through those 5 stages?
Most people, yes.
Okay.
But again, different medical problems can also cause them to be waking up throughout the night. And certainly, the frequent urination during the evening is something that we often address. And sadly, that's probably one of the more common things that people will experience and suffer, but just internalize, not speak with their physician about it, not bring it to our attention. And that's unfortunate because there are many options for people to significantly improve their quality of sleep by fixing that problem.
So it seems like a lot of those symptoms can be fixed and then be able to help the patient sleep at night.
Absolutely.
Soundly. That sounds good. Well, that's perfect. Well, if you could give us one tidbit to help your patients sleep better at night, what would that one piece of information be?
Just one piece would be difficult.
Or two.
Okay, let's do try to keep with a regular routine
Okay.
throughout the night, and not just weekdays. Weekends are also just as important.
Okay.
So approximate the same bedtime, the same arousal time is a perfect start. And to make sure that the bedroom, like we said, is dark, is quiet, we don't have things that could potentially be waking us up. And those two issues are a perfect start to getting better sleep.
Well, perfect. Well, thank you so much. Thank you for coming in and sharing all of those great information with us today, and we really appreciate you being
Thank you
here.
very much for having me.
Thank you. Take care.
You too.
Thanks.
To learn more on sleep and your health, visit mclaren.org/Macomb Healthy Sleep.